Just a moment, but Elijah Cummings has just emerged from the White House in his meetings with President Trump on drug prices. Let's listen in.
They make some remarks.
We had the meeting today is one which actually began when I first came up, when I ran into the president during his inaugural luncheon. And we agreed that we should talk about prescription drugs, the high price of prescription drugs, and how this had become the #1 issue, health issue for most Americans, independents, Democrats, and Republicans all see this as the #1 issue, even above the Affordable Care Act. We presented a proposal to the president which would allow for the federal government to negotiate drug prices, which we thought was very important because drug prices are going up higher and higher, and more people are saying that they cannot afford the price of their prescription drugs. And I must tell you that the president was enthusiastic about our proposal. We presented to him a bill that we will be filing in about 2 weeks, and we asked him and Secretary Price, who was present in the meeting also, to take a look at it and give us their comments. And then it's our hope to be able to file it in 2 weeks. Again, he was enthusiastic, and he was clearly aware of the problem, and clearly he made it clear to us that he wanted to do something about it. There were 2 other issues that I also talked to him about, and that was when I said to him, Mr. President, most respectfully, when you're talking about the African American community, I want you to realize that all African American communities are not places of depression and where people are being harmed. As a matter of fact, I let him know that I've been living in the inner city of Baltimore for some 35 years in the same house, and that I think it would be good for him to acknowledge that most African American people are doing very, very well, and that certainly we all welcome his efforts to improve our communities. The other thing that I talked to him about, and then I will get to Congressman Welch, is the whole voting situation. And I told him that I understand that Secretary Pence will be conducting this investigation with regard to voting fraud. And I told him that I thought that voting fraud was all but non-existent. And I said to him that we had sent him a letter and sent Vice President Pence a letter saying that while we believe that voting fraud is all but non-existent, the thing that we do know is a problem is voter suppression, and that you cannot have I think, any kind of reasonable investigation of voting in the United States unless you deal with that issue. Finally, I told him that I was glad that he was able to meet with the presidents of the historically black colleges and universities, and I said to them the most important thing for those colleges and universities right now is they need funding. They need more funding. And so he said he would work on that. And so we again, our next thing is, again, we presented the proposal to him and Secretary Price, and hopefully we'll hear from them very, very shortly. Peter?
Thank you, Elijah. The initial part of the meeting was about the incredibly high cost of prescription drugs that's really hammering people. You know, our pharmaceutical industry does a couple of good things. They create life-saving and life-extending drugs and drugs that relieve pain, but the price is starting to kill us. We just can't afford it. And what we were proposing, this is something that Elijah and I have been working on for a long time, was to let the Medicare program, which is the biggest purchaser of prescription drugs, negotiate price discounts. And President Trump gets it on the issue of getting a good price. Basically, what the Medicare program does is that it buys wholesale but pays retail. And that is not the way you run a successful business or a successful cost-saving program. So we presented our proposal, and the president seemed, first of all, number one, very on top of it. Number two, he understood it was about saving taxpayers' money. And he talked about what he did with the F-35, where he did some negotiation and saved billions of dollars, or hundreds of millions of dollars for the American taxpayer. And third, he really expressed concern about the lives of people who need these life-saving drugs, but are every day put in this terrible choice where they have to risk a loss they can't afford, a child who needs an EpiPen, or pay something they can't afford. And that's not a choice that we want, and that's not a choice that he wants. So I left this meeting encouraged that we've got some real prospects of getting lower prescription drug prices for the American people.
Dr. Miller.
I will just add I was honored to be invited by Congressman Cummings.
All right. What turned out to be a wide-ranging time with the president. They went in at 2:30 Eastern Time to talk essentially about drug pricing, and came out, and you heard with Elijah Cummings. He's the ranking member, by the way, of the House Oversight Committee, so he would be involved in any investigation into voter fraud. That's why he brought that up, and then he brought up other issues involving the African-American community and the views thereof.
I thought it was also really interesting that you heard that Democratic congressman from Vermont, Welch, saying, quote, let Medicare negotiate, saying it pays retail and it buys wholesale, and that's not a successful way to run a business. But again, perhaps some support building for that to happen to be a huge change, if so.
Certainly, it's been a thorny issue for a number of years. It was job one during the Bush administration, the second Bush administration, all during the Obama administration, and it's something that President Trump is taking up as well.